Assalamualaikum and good afternoon everyone. Today, I will briefly present our group case study titled Quality Management in Public Healthcare, a case study of Hospital Tuanku Fauziah Perlis. Hospital Tuanku Fauziah or HTF is a major public hospital located in Karna Perlis, serving as a key healthcare provider for the northern region of Peninsular Malaysia. In this setting, quality assurance or QA is crucial to ensure that healthcare service meet professional standards. However, like many public hospitals, HTF face ongoing challenges such as rising patient expectations, that documentation system, limited resources, and inconsistent service delivery. The main problems identified in the study include long on-patient waiting time, poor communication between staff and patient, and delays in documentation. This issue not only reduce service efficiency but also pose risk to patient safety and increase pressure on healthcare workers. Therefore, our project applied a structured quality assurance approach to identify the root cause and recommend realistic improvement.
This study focused on three key research questions. First, what are the quality assurance issues at HTF, especially related to service delivery and patient satisfaction? Second, how do patients, caregivers, and staff perceive the current process and system? And third, what strategies can be proposed to improve the hospital quality management practice? To get our study, we outlined the three main objectives. First, to identify key service quality issues at HTF, especially in emergency care and medication handling. Second, to access satisfaction and feedback from patients and caregivers. Third, to propose practical, data-driven strategy for continuous quality improvement. Lastly, the significance of this study is that it offers valuable insight into the quality challenges faced by public hospitals like HTF. The finding not only help HTF and the Ministry of Health make target improvements, but also serves as a practical reference for healthcare professionals and students. The goal is to create a model that can be replicated in other public hospitals across Malaysia. Thank you.
In this presentation of literature review, we will explore the critical role of quality assurance in healthcare, focusing on the challenges faced by Malaysian public hospitals like Hospital Tuanku Fauziah and how the MAIC framework from Six Sigma can help address these issues. Quality assurance is essential for delivering healthcare that is efficient, safe, and patient-centered. Malaysian government hospitals, including Hospital Tuanku Fauziah in Perlis, face persistent challenges such as overcrowding, long patient waiting times, and inconsistent service quality due to limited resources. These issues often result in patient complaints about delays and unsatisfactory staff interactions, which negatively impact patient satisfaction and trust in public healthcare. To improve service quality, the Ministry of Health Malaysia encouraged hospitals to adopt quality management systems like ISO 9001 and MSQH accreditation. Complementing this, the DMIC framework, standing for Define, Measure, Analyze, Improve, and Control, is a globally recognized data-driven methodology from Six Sigma designed to target and solve process inefficiencies. High-quality healthcare, as defined by the World Health Organization, must be clinically effective, safe, responsive to patient needs, and efficient in resource use. However, Malaysian public hospitals often struggle with high patient loads, limited staffing, and inadequate facilities. Common problems include long waiting times, poor communication from staff, and delayed administrative processes, which reduce patient satisfaction. The MAIC is a structured approach to quality improvement. Define the problem clearly, involving all stakeholders. Measure key performance indicators such as waiting times and patient satisfaction. Analyze data to identify root causes of inefficiencies. Improve processes by implementing targeted solutions like staggered appointments or staff training. Control the improvements through continuous monitoring, audits, and feedback. Studies have shown that hospitals applying DMAIC have reduced patient waiting times by up to 40%, streamlined operations, and enhanced service quality. In Malaysia, case studies from Kuala Lumpur and Penang hospitals demonstrate significant improvements in outpatient and pharmacy services using this methodology. For Hospital Tuanku Fauziah, the MAIC offers a strategic, low-cost and systematic method to improve service delivery without major infrastructure changes. It enables data-driven decision-making, targeted interventions, and scalable solutions, aligning with national quality standards such as MHQH accreditation and supporting Malaysia's healthcare modernization efforts. In conclusion, integrating quality management systems with the DMAIC framework provides a powerful toolset for Malaysian public hospitals like HDF to overcome resource constraints and improve patient care outcomes.
Now, I will present the methodology of our study, which focus on Hospital Tuanku Fauziah in Kangang Perlis using a case study approach. This method allows us to explore a real-time issue in public hospital setting, especially related to quality assurance and service delivery. We applied a mixed method design combining both quantitative and qualitative techniques. Data collection involved. The first one is patient and caregiver surveys to gather feedback on waiting times, staff attitude and communication. The second one is semi-structured interview with hospital staff like doctors and nurses to understand internal workflow challenges. The third one is direct observation at key service areas to monitor patient flow and staff compliance with SOP. The last one is document review, which is of hospital SOP, audits and previous QA reports. For analysis, we use the DMAIC framework from the Six Sigma methodology. Define, we work with stakeholders to identify key problems like long waiting times and poor communication. Measure, we gathered baseline data like patient wait times and satisfaction score. Analyze, using tools like the fishbone diagram and 5 why, we identified root causes such as poor scheduling and lack of customer service training. Improve, we propose practical solutions like better appointment system and fast-track lanes. Control, we suggest long-term strategies including KPIs, feedback loops and regular audits to maintain improvement. In short, this structure and data-driven approach help us create actionable recommendations to enhance service quality at HTF.
Assalamualaikum, and now I will present the result and finding from our study on quality management at Hospital Tuanku Fauziah in Perlis. Using the DMAIC methodology, we started with the define and measure phases. Through stakeholder discussion, patient feedback and internal review, we identify 4 major issues. The first is patients were facing long waiting times, especially in outpatient department. Second, there were clear communication gaps between staff and patient. Many were unsure of their diagnosis or follow-up steps. And thirdly, manual system for queue management and documentation created delays. And lastly is inefficient scheduling causes overcrowding, particularly between 8 to 10:30 a.m. We support this finding with data. A survey of 100 patients show 65% dissatisfaction with waiting times and 47% feel uninformed about the treatment. Our time motion study revealed an average total outpatient visit time of 92 minutes, well above the Ministry of Health target of 60 minutes. Now, for the next part is analyze and improve phases. We use tool like fishbone diagram and 5-way technique to explore the root causes behind this problem. So we discovered that there was a lack of staff during peak hours. Appointments were not distributed evenly throughout the days. The hospital relied heavily on manual tracking and the physical layout and signage were confusing the patient. Based on this, we proposed 3 major solutions. The first is introduce a digital queue management system to automate numbering and display real-time status update, restructure appointment slot and categorizing patients by urgency and types, Lastly is conduct staff training focused on communication and SOP compliance. This improvement was tested throughout a pilot program in the internal medicine outpatient unit. So the results were encouraging. Average waiting time reduced from 92 minutes to 58 minutes and overall patient satisfaction significantly increased. Now, lastly is the control phase. We focus to sustaining this improvement over time. We develop KPI dashboard to track monthly performance. Second is QR code-based feedback forms at exit point. And lastly is regular internal audit and staff performance reviews tied to quality indicators. So these three measures ensure the improvement are not one-off but embedded into daily routine. By establishing a culture of accountability, Hospital Tuanku Fauziah can maintain high service standard and continue improving over time. So in conclusion, this study not only identified major inefficiency but also proved that structured quality intervention, even with limited resource, can deliver real and lasting impact. So thank you from me.
Last but not least is the conclusion. Okay, for the conclusion, the study concludes that implementing structured quality assurance intervention, the DMAIC methodology at Hospital Tuanku Fauziah effectively address key service delivery challenges such as long outpatient waiting times, inefficient communication, and outdated scheduling system. This by introducing targeted improvement like digital queue management, optimized appointment scheduling, and enhanced staff training. The hospital archive reduced waiting time and higher patient satisfaction, demonstrating that systematic, also data-driven quality management and significantly enhance service efficiency and provide a replicable model for other public healthcare institutions facing similar issue. Thank you.